Hi, this is your County Executive Ed Day. We're here again today for a bi-weekly update on the COVID-19 crisis here in Rockland County. First of all, before I forget, if you should have a pen and paper with you so we can go through some numbers and information that'll be coming very handy at some point if you have some questions. Also, we have with me my proverbial man behind the curtain, John Lyon, my communications director, who's been taking your questions. And before we get to the questions, I would just like to take a moment just to acknowledge a very terrible time we had here in Rockland County a couple of days ago. The passing of Paul Pipperato, the county clerk. Paul was one of the most genuine, warm, and loving men I've ever met in my entire life. He genuinely cared about people. The first time I met Paul was when we were both serving on the Arc of Rockland Foundation board together. His commitment to his community was second to none. His loss is a shock. He was only 61 years of age, and we just want to take a moment to remember him, have our thoughts and prayers for Flora and the girls, his 3 daughters, and his entire family. Again, just a tremendous loss for Rockland County and for our local community up in Haverstraw. And also want to take a moment to acknowledge the passing of Ed Finn. Ed was the hallmark of the Wayne Hose Fire Department up in Stony Point. He served as town councilman, just a tremendous man. I met him a number of times, and I actually met him through his son Jeff Finn, who was the supervisor of Stony Point for a bit of time some time ago. So I just want to acknowledge those 2 gentlemen for their lives. Of course, we miss them. They're not being with us hurts many people tremendously, but we should try to remember to celebrate what they were all about. And again, 2 amazing men. With that, John, I guess I could start off with some of the numbers we have here in Rockland County. As of right now, during this crisis, we've tested 34,959 people for COVID-19. Of that, 12,280 have tested positive. We have hospitalized now. It's a downward trend, which we'll get into a little later in the broadcast. 181 either COVID-19 confirmed or suspected hospitalizations right now. And fatalities, sadly, we've lost 557 people to the COVID-19 virus. So with that, John, let's have at it with the questions.
Okay, so the first one came in. This is their word, not mine. There are many self-described Rockland County snowbirds who are still in Florida or other locations. When do you think it will be safe for them to return home to Rockland?
I would say this. I'm going to be very direct about this. I believe Rockland County is safe right now as long as people continue to take on the best practices we've spoken about. Proper social distancing, wearing face coverings when out in public. Or in areas where you're going to pass through and pass by other people, just as the governor had recommended. These things have had an effect, and we are going in the right direction. So to the snowbirds out there who are fed up with the warmth and they want to come back to some more moderate weather, we welcome you back home. So just come on back.
Okay. A resident was asking, will telecommuting and working from home continue to be in order in Rockland County to help avoid exposure?
Okay, we've got a lot of questions that cut through some of the fine details here, but at the end of the day, we have to understand something. The official orders that are given out are leveled by Governor Andrew Cuomo. These are his orders. It is possible that some businesses may continue to ask their employees to work from home to better enable social distancing. A lot of companies and even government entities have learned a lot through this crisis, different ways of doing things, for example. But that said, I don't have a crystal ball as to what will be coming out of Albany next. But I cannot say for the future certain what the future holds. But again, once we get any information, and we typically don't get heads up on this. I had a conference call with my fellow county executives, the New York State Association of Counties, a couple of nights ago. And one of the frustrations we have is information is flowing out to all of us at the same exact time. And you naturally come to your local municipalities, supervisors and county executives and council people and mayors, and ask them, what does it mean? And we have not been prepped. So we're hopeful that the governor going forward will do a better job at that. It makes our life a lot easier, and most importantly, it serves you all the much better. I can say that as it relates to the working at home and stuff, I have been tremendously impressed by the great work our Rockland County employees have been doing from home. They're continuing to meet the needs of our residents and to connect our residents with services, especially at a time like this. Social services is working very hard with fewer people on site, but they're picking the slack up by telecommuting, and they've adapted. And I think even more than that, they have thrived in the situation. So we're getting a lot of things done. We're getting services done. We've done programs for seniors even, getting food to them. So it's a lot of things that one would think could never get done in under these crisis situations, and they are getting done. And accolades are due to our county employees for doing that.
Okay. And as people start to think about heading back out there, some things related to getting around might have lapsed. What are the extensions for car inspections and driver's license renewals? Will there be any sort of grace period after the DMV reopens? And what about buying or selling a car?
Okay, very good. Well, I'll tell you straight out, take good care of the car you have. I'll tell you why in a minute. Initially, there was no grace inspections, no grace period being offered for inspections. That has changed, but we would expect them to be extended, once the DMV does open up back up. So I'm hopeful that they do that again. We don't know for sure, but one would like to think that since they loosened up the rules to allow extensions to begin with, I think there's going to be recognition, or I would hope there's recognition by the state that you can't everybody go back to the DMV on a Monday morning. It's bad enough as it is right now. We don't want to have a situation like that. So we hope to have a protracted, phased-in approach towards getting your lives back in order. In terms of buying and selling a car, many steps related to this process you can do online, but you'll be unable to register your vehicle until DMV opens. So getting a new car right now would be problematic. So as they take good care of the car you have for the time being.
And if there are any other questions about the DMV, their website has a large number of helpful hints and a lot of information related specifically to COVID-19. And I will post the link to that in the comments section when this is over.
A lot of the websites, John, will be posting on the comments section, so check that after you're all done.
Another question looking a little bit forward, will children be able to have fall sports this year? Will camps be opening this summer?
Right.
Sort of what's happening next?
Well, again, I'm going to be saying this a lot today, but the reality is the decision will be made by Governor Cuomo and New York State. As a reminder, the governor has barred our ability to issue any local emergency orders that relate to COVID-19. So we can't even use the same executive authority that he is using right now at a statewide level, and that's just a practical matter right now. But again, it does interrupt our ability to get the information to you. For those who are looking at the camps and the pools, that is going to be a decision made by the State Department of Health also. They have to have some input into that. But just so you know, I've had this conversation with the governor's representatives a number of times, specifically as it relates to camps and pools, because you just can't decide to open the camps and pools up and say, okay, let's go tomorrow. A lot of work goes into them. We've spoken to a number of camp operators and people who are looking to open pools up. They have to lifeguards. They have to get employees. They have to get registrations. They have to make sure youngsters have the immunizations. There's a lot of things that go into preparing for a season, and I emphasized again just this morning how important it was that a decision be made in this area, and that's where we are right now.
Okay. We received quite a few questions today about when specific types of businesses and religious institutions can reopen and what phase of the governor's plan they're in, when phase 1 through 4.
Okay, I think many people have already seen some of the local media coverage. You might have seen the governor on TV. When you see all this information, it's great, but it does not have a lot of detail. So when you ask very specific questions, the answers are very unclear. We just don't know when many categories of businesses will be allowed to reopen. We don't know the specifics about how they will be carried on that chart. So, we expect the governor to share more specific information in the coming days, and we will pass all that along once we're made aware of it, or you may see it yourself directly. But what you can do, if you have any questions now, there's two ways. You can make a phone call to the governor's office at 518-474-8390, 518-474-8390, or you can go online to ny.gov. ny.gov. There's a lot of information there, including the emergency orders, some definitions. It may help answer your questions so you don't have to wait, so I would simply direct you to that.
And staying with the governor's phased plan to reopen, retail is currently listed in phase 2 of the plan. Is opening retail different from opening large gathering places like shopping malls?
Honestly, again, this is a source of frustration because we're not inside the thinking processes of Albany right now. The current plan lacks some critical detail. Frankly, there are a lot of areas where I see very little difference in, and they're being treated differently. And again, it's frustrating for us here in Rockland County. When it comes to large shopping areas, and we'll have more information as we get it, we will share it. But again, the difference between a shopping mall and going to a grocery store, either way you're exposing yourself, either way you have to socially distance. And some could make a case that in a shopping mall, a large shopping mall, you may have more room to socially distance. So a lot of this has to be worked through. I do want to stress an additional wrinkle that we have gotten in the governor's plans. He's requiring that each business and industry must have a plan to protect employees and consumers, make the physical workspace safer, and implement processes that lower risk of infections in the business. Just so you do know, we already are on that. We already are messaging out that information. We are communicating through our Economic Development Department, Jeremy Schuman, who is our director, working with a variety of different business organizations to get that process moving. So they already know, most of them know already exactly what they need to do when it comes down to that. I got the list that the governor provided us, and I'll share this with you. Some of the things that they're looking to do, and it's important for everybody to know that, whether you have a business or not, but it's important that you know these things. Adjust the workplace hours and shift design as necessary to reduce density in the workplace. Enact social distancing protocols. Restrict non-essential travel by employees. Require all employees and customers to wear masks if in frequent contact with others. Implement strict cleaning and sanitation standards. Enact a continuous health screening process for individuals to enter the workplace. Continue tracing, tracking, and reporting of cases. And of course, we have to have the legal people happy. We have to develop liability processes. So again, nothing here is shocking, frankly. I think everybody can agree that most of this is pretty much common sense. So it's common sense in the age we're living in now. These are things that maybe people never give much thought to, but now with a virus around, people are paying a lot more attention. And I think most people will welcome these steps to be taken because, as I said the last time we were on, part of this process is for organizations, businesses, industry to do things to get back online, but there also is going to be a need for them to address their clients, their customers, so they have a comfort level of getting engaged again. You open up a restaurant, for example, you may be doing everything right, but you have a number of people who are kind of like holding back right now because of what's been going on for the past couple of months. So it's going to be incumbent upon these outlets to make their customers comfortable, their clients comfortable, so they can re-engage and truly open up your economy again. And that has not been spoken about too much. I think it's important that we all recognize that.
For sure. So, looking really locally here, how is Rockland County doing specifically in terms of meeting the governor's criteria for opening?
Yeah, we've got a number of questions like that. And to be clear, the current plan calls for these criteria to be met regionally, not by each county. Before there's reopening. So Rockland's specific numbers will be included with the rest of the Mid-Hudson region, which is made up of the following counties: Westchester, Orange, Ulster, Dutchess, Putnam, and Sullivan counties. That is the Mid-Hudson region, and those are the counties that we're tied to on a regional basis. We get a breakdown such as this. This is from yesterday, I believe. So this is what we use to see how we're doing as it relates to meeting the standards as we are right now. On a regional basis, we currently meet 4 of the 7 criteria, which are hospitalization decline, 14-day decline based on a 3-day average. Right now, Rockland County has met that. Tremendous work being done in our hospitals. A decline in hospital deaths, 14-day decline based on a 3-day average. Rockland has met that. However, the region has not met that as of yet. New hospitalizations under 2 people per 100,000 residents based on a 3-day average. The region has not met that yet. We are still seeing too many intakes locally, so we have not met it yet either here in Rockland County. Some more fine points. Total beds available. Have at least 30% of total hospital beds available. That has not been met here in Rockland County. However, with intensive care unit beds, ICU beds at 30% threshold also of open beds, Rockland has met that, as has a region on both of these categories. Now, the other thing I will share with you, the numbers that are being expected to be, the benchmarks expected to be hit. I've had conversations with professionals in the field, and they do not believe these numbers are legit, are accurate numbers to be hitting. They think they're way too low. This is the opinion of professionals in the field. So I'm hopeful that there is more. I'm hopeful that there is a good back and forth, or a good, a good conversation between the governor's people who are making these rules and those professionals in the field who have to live with them, and who have in fact lived with them and have gone through issues in their own hospitals. Diagnostic testing capacity, conducting 30 diagnostic tests for every 1,000 residents per month. Rockland has met that. Tracing, we have to have at least 30 contact traces per 100,000 residents. So for Rockland County, we're looking about 100. We're in the process of ramping up our numbers of contact traces and expect to meet this standard in the coming days. From the perspective of the region has not yet met that match. So in some areas we are ahead of the region, some areas we're behind the region, and that's where we stand. You can expect more news on this criteria and our efforts to meet them in the coming days. We recognize that May 15th is coming. We have a number of initiatives we'll be doing to get there. We are doing everything humanly possible to meet these standards to reopen Rockland as soon as possible. But one thing we have to understand here, there are just, I would say, too many anomalies we're dealing with right now. For example, we looked at how many fatalities we've had here in Rockland County, 557 fatalities. We have had 98 fatalities in nursing homes. That was shocking to everybody when it came out, and there's still a lot of doubt as to what's going on with that right now. Recently, there was an announcement of the percentages of people who are getting contracted in the COVID-19. 66% in one cohort contracted the COVID-19. These were people who were older, who were retired, and were at home. It kind of runs counter to the advice we've been getting that, if you stay home, you'll be safe. Somehow, some way, 66% of those folks got the COVID-19 virus. And also the governor himself making a comment about the fatalities and saying we have to take the numbers with a grain of salt. From someone where I'm sitting, if we're using that number as a benchmark, we cannot be saying take it with a grain of salt. There should be some certainty to what we're looking to strive for in order to be able to move forward with the plan to reopen. So again, hopefully some of these things will come out as we go forward the next few days. We're hopeful that will happen.
And we're all seeing a lot of statistics these days. We see them on the news regularly. We're seeing them on the Rockland County dashboard that presents a lot of our numbers.
Right.
People are looking to see the number of recovered patients.
Right.
They're asking if this will be added to the dashboard and
Right.
if we have the information
Okay.
available.
Well, we try to report as much as we can that's germane to what we're dealing with, but the hospitals do not report the number of patients which have recovered to us. So we do not plan to add that data to the dashboard. And also, please understand something. We have a finite amount of resources available to do a lot of necessary things, and that's a decision that falls to me, obviously. We have to make sure we are able to get a lot of things done to get us back on track. We have to get a lot of information out. We have to do a lot of investigations into these deaths. There's a lot of work that goes on. We've mobilized many people here in Rockland County government. We're tapping into volunteers. So it's really a Herculean effort that we're doing. And again, as I remind people, we've had this rodeo before. Last year was a very similar scenario in many ways with the measles epidemic, and we did well with that. So what I will just tell people is, have some faith in your county government. We've done this before. We know people want to have all the information as possible. We try to get that to you, but some information does not come to us. and in order for us to go get it, we'd have to take people away from other very critically important tasks to get that information. So it's a balancing act. That number is a much better indicator. The number of hospitalizations, for example, is a much better indicator of how we're doing at any given time. And also I almost forgot one thing. That hospitalization rate, that data has been going in the right direction. We have the numbers separated in two categories on our dashboard. One are confirmed cases, one are suspected cases. But when you take a look at the COVID-19 infections, whether they be combined, suspected cases and confirmed cases, on April 16th, the number was 310 people were hospitalized. 2 weeks ago, on April 23rd, the number was down to 248. That's 62 fewer. 1 week ago, on April 30th, the total is 196, 52 fewer. So significant drops. Today it is 181. It's a continuing downward trend. That is a wonderful thing to see, because we're talking about people who we've all heard about the COVID-19. Some people have gotten it, they've walked through it, thought they had a cold, had no symptoms to speak of, and that's one of the things that really is very difficult for us to deal with, because if you don't have it, this is why you have to be handle yourself properly from a hygienic perspective and a social distancing perspective regardless. But the hospitalizations are very important, because these are people who are significantly ill. It gives us a chance to understand the cohorts of exactly who is getting sick, but it's, I think, a better measure than the mere people who test positive. And frankly, I think it's a better measure than fatalities, because fatalities often are skewed by the fact that people who have underlying issues and people who are older will pass away at a greater rate. So the hospitalization rate is important because it encompasses all ages, all demographics, and we're seeing it go in the right direction. The one thing I will emphasize, hospitals have the situation under control. They were at breakneck speed not long ago, and again, I remind people, this sounds like we've been in a twilight zone for about 6 years, and it's only been a couple of months. It's how rapidly this has evolved. But we've got to do everything we can do to support the hospitals, our frontline workers. What we can do is try not to put them at risk. If you continue to adhere to social distancing, if you're wearing a mask, washing your hands and doing it frequently, disinfecting surfaces frequently, these are all very important things to do to knock down the virus and minimize the impact upon family, friends, and those are first responders and our healthcare workers. And I'll give a shout out to those young men and women who are manning the cash registers in our grocery stores. Those folks are maintaining our food supply. Think about that. They're very, very critically important people. Let's do the right thing by them too.
Okay. And another question, how is the county government working towards future planning to assure educational equity for all students in the county, specifically with accessing digital learning from for homes that may not have computers, may not have Wi-Fi, may not have tablets, that kind of thing?
Right off the bat, we have a great partnership with BOCES and with our districts. Again, I remind people that the measles epidemic last year, we had every district superintendent on a conference call with BOCES, Dr. Mary Jean Marsico, myself, emphasizing how important immunizations were. And they all did what they had to do. They got the word out to the schools. Our immunization rates were brought back up to where they're supposed to be, protecting the entire county. So we're very fortunate to have some very special superintendents and building managers, our principals in the school system. But we don't have a direct role in overseeing them. We work with them. We help them with purchasing. We do other things. But that falls to the New York State Department of Education. They're the ones who do this. However, I do know that many of our districts have provided tablets to their students. They've stepped up that effort during the crisis. I also want to thank Altice USA Optimum, for which they have opened up their emergency Wi-Fi hotspots for public use to non-subscribers. Also, I want to acknowledge, and this is just something that's a little special, in my world. Years back, I coached with the New City Rams in Pop Warner football. And one of our biggest rivalries was with the Valley Cottage Indians, and it was a few years back when my son Michael was playing. I was coaching Mike. There were two young men, twins, the McCourty twins, Jason and Devin, who were playing for the Valley Cottage Indians at the time, and these were two serious football weapons. There was no other way of putting it. Very difficult stopping these young men, and very difficult for our running game to work. against the speed these two young men had. Well, they were very special then, and they are very special now, and I want to publicly acknowledge them here today. They're with the New England Patriots. Now, John is a New England Patriot fan, so he's smiling right now. I am not. So, but we'll put that aside for the moment. They are with the New England Patriots right now, both playing in the same team. I don't think it's ever happened before, twin brothers playing on the same team. But they didn't forget where they came from. They were very generous. They purchased $90,000 worth of Chromebooks for the school children that they went to when they were younger, East Ramapo and Nyack. And these young people who don't have access to computers at home. These are two very special young men who who decided to pay it forward. And I just want to publicly acknowledge them and tell them I'm not upset with them because I really couldn't beat them on defense when I was coaching. Very, very difficult. But if you, again, getting back to the Wi-Fi settings for non-subscribers, to join, and again, I want to acknowledge Altice Optimum again. If you want to join in the Wi-Fi settings of your device, select the Optimum Wi-Fi Emergency Network name and follow the prompts to log in. Again, go to your device, select the Optimum Wi-Fi Emergency Network name, and just follow the prompts to log in. Also, our local school districts also have a lot of great information posted on their respective websites. I would urge you to take a look at that. Also, it's available through the Rockland BOCES website. And one thing I will agree with the governor on, we're all learning something. Nobody expected this kind of crisis, and the schools now obviously are going to have to rethink what happens if, because the if did happen. Not just schools, municipalities, county government. We operate under emergency operations here. Now, thankfully, I can say with certainty and with a straight face, because the background I have with law enforcement, I am very pleased with how things have worked out. But again, when all these things calm down, what happens is you do a post-event critical analysis of what occurred, what could you have done better, and you become better for it. So the next emergency comes along, you can serve the people even better in a crisis. So, but right now, I said we've done a good job here, but we're going to have some other things to do.
And just to readdress one thing that keeps popping up in the chat here, there have been additional people asking certain businesses what phase they're in. To reiterate, we don't really know. The governor's plans do not have a lot of detail, so we can't really drill down into that information until it's presented to us.
And exactly right. Again, I shouldn't have to apologize for this, but I am apologizing. I wish that we had this information to give you, but I will assure you, as we have always done here in this administration, as soon as we hear something, find something out, we're going to get it to you. And that's what the idea here today. We're going to be also taking this video and putting it on YouTube for those who don't have Facebook. So we're getting the information out as best we can. You know, again, ny.gov, there may be information on there that would satisfy some of your questions, and we'll go from there.
What is some good news that you can share with us today?
Good news. Good news. All right, this is an issue that came up and got knocked down and is now back up again. I'm told that this is alive and well again. The U.S. Small Business Administration, the SBA, has announced over $100 billion in Payroll Protection Program, PPP funds, and still available to small businesses and nonprofits. I know there's some issues with this. The money disappeared very quickly. We checked on this today. We're being informed that the money is available. So if you have not applied, please do so. This was created by the CARES Act. The second round of PP funding was released on April 27th and provides low-interest loans to borrowers to cover 8 weeks of payroll costs, rent, utilities, and mortgage interest. Under the CARES Act, loan payments may be deferred for 1 year and are retroactive from February 15th, 2020, so employers can rehire their recently laid-off employees through June 30th of 2020. For more information on this program, borrowers can visit the SBA lender locator at www.sba.gov/PPP. I'm going to repeat that again, www.sba.gov/PPP. And again, John will be putting this on the comment section as we go along. Also, again, as I mentioned earlier, the piece of paper is important. Some of the numbers that you should have at hand are our Department of Health hotline here in Rockland County, 845-238-1956. This is not for immediate response. If it's a daytime event, you can call the health department for guidance. They will respond, but again, they are not on patrol per se. They're at the offices doing what they have to do as part of the effort to combat this virus. So if you see something and if you want an immediate response, if it's something like a crowd that's gathered, something that's actively fluid is going on, the best bet is to call your local police department. They are absolutely authorized to deal with the issues that are presented either by the governor's emergency orders or the health commissioner's orders. All those orders have it attached to them the necessary thing for law enforcement for them to take action, criminal penalties. So they have the authority of law behind them. So they can address the things that are current and moving, and you can certainly call the health department also if you wish, but the health department is working very well with law enforcement. They're all doing a great job out there. The governor's office I gave earlier, any questions you have that are really emanating from his office, 518-474-8390, 518-474-8390. The State Department of Health hotline, 24/7, particularly if you want to get tested. That number is 888-364-3065. Again, 888-364-3065. Another number you can use is called the Pause Task Force. They take complaints in from people. They will look at them, they'll vet them, they will ship them back to the county to one of the 3 points of contact, which is a sheriff for a law enforcement investigation, our district attorney for a prosecutorial investigation, and our Department of Health for health violations. This would be a situation where you have a store across the street from you or in your neighborhood, and it's open, and you believe that that store should not be open from your understanding of the emergency orders. So I would suggest you call the pause number that I'm going to give you, because they will vet your complaint. They'll make sure that, yes, in fact, that business should be open or closed, and if they have something that has to be worked on, they'll get it right back down to us, usually the following day, and we'll address it. That number is 833-789-0470, 833-789-0470. Finally, your own county website. There is so much information on our website as it relates to many, many things in Rockland County, but particularly you're looking at this issue right now with COVID-19. That website is rocklandgov.com, rocklandgov.com. That dashboard we referred to, which again looks like this, that dashboard is on. There's there's different levels of the dashboard. They have different information pieces on there. You can navigate through it. There's other information, what you should do, what you shouldn't do, information and other resources on COVID-19. So certainly use that as you need to. And finally, ny.gov, which we've said a number of times, ny.gov. That is the New York State website. And again, you will find the emergency orders there, some information on essential, non-essential, and maybe some of the fine points that you're looking for might be in there, but that's the New York State website. First of all, I just want to thank all of you for joining us today. And again, we will be doing this again on Tuesday. We endeavor to do this twice a week, Tuesday and Thursday at 4:15 p.m. And today, look, very simply, these are difficult times. This is a time this is a time of our lifetime as it relates to challenge, as it relates to crisis. Not to acknowledge that there's stress and fear and worry as part of it would be unfair. We are going to experience that, so please accept that. The issue of stress and fear and worry only becomes an issue when you don't know how to put it together and find a place for it. Start by very simply looking at the fact that we are still functioning as a society. We have a number of things that are going on that can be scary. We have a number of things that are going on that have changed our way of life in the short term. All I'm going to ask you to do is understand that we have to believe in ourselves, believe in the fact that we can get through this, and we will get through this. We're not going to lose this battle. Our country, our county has met challenges before. We are meeting this challenge head on. You have many people who are working very hard. And again, I said this our last Tuesday. You have town supervisors, council members, elected officials, other elected officials, our highway departments, health departments. social services. All these departments have people there who are working very hard, who care deeply about their community. Our local village mayors and their trustees. These are the folks who are out there doing what they can do to make the best judgments possible to get us through this. With the guidance that we try to provide based upon best information, our employees, our staff, the people who are out there getting the job done will get that done, and we will get through the other side. So I would just very simply say, let's stay together, work together, let's be smart about what we're doing, let's not be reckless, and continue what we're doing, because we all win in this battle, and we are going to win this battle. So with that, this is Thursday. We'll give you a jump on the weekend. Have a great weekend, and we will see you next week.